Okay, I think we're all here. Good afternoon, ladies and gentlemen. I'm Todd Anderson. I'm the incoming and new Dean of the Cummings School of Medicine. Very excited to have you all here today. I'd like to start by acknowledging that we are on the traditional lands of the people of Treaty 7. That includes the Blackfoot Confederacy, that includes the Siksika, the Kainai and the Piikani First Nations, the Tsuut'ina First Nation, and also the Stoney Nakoda, which includes the Chiniki, Wesley, and Bearspaw First Nations. Calgary is also home to Métis Nation of Alberta Region 3. And we have the privilege of working and growing and thriving on this land, coming together in a good way. Great healthcare requires many things, which we have in Alberta, but it particularly requires a great partner, and the University of Calgary is that partner. The university provides many faculties that create new knowledge and new innovative curriculum that helps us work with our partners at Alberta Health Services and at the Government of Alberta to create first-class, world-class healthcare. And we're fortunate to have that. If you look at the website for the Cummings School of Medicine, our vision is creating the future of health, and that requires us to do three things. Number one, we provide wonderful people. We give them the resources through platforms, and then we have partnerships. And our most important partnerships are with our healthcare providers, the ministry and Alberta Health Services, and what we do there is to create impact within the province for our patrons, and that's our customer. It's the individual patient and the healthy communities that we have. And so I'm very excited today to introduce Minister Jason Copping, who is going to talk to us about some new initiatives that are really going to help us expand healthcare through research in our most vulnerable populations, those with palliative care needs and end-of-life care. Minister.
Thank you so much, Dr. Anderson, and thank you all for coming today. It's great to be here at the University of Calgary, and I'd like to thank the U of C for hosting us. And great to be in the riding of Calgary Varsity, very close to home for me. As mentioned by Dr. Anderson, treating people with dignity and respect is a foundation of our health system, and it applies particularly at the end of life, when patients are at their most vulnerable and when their family and friends are facing the loss of someone that they love. Providing care and comfort at the end of life is an essential part of healthcare, and it's essential to us as a compassionate society. That's why when we campaigned on increasing access to palliative care in 2019, and why it's a priority for me as Minister of Health and for our government. In November 2021, based on the consultations led by my colleague, MLA Dan Williams, I announced the latest step in the work to deliver on our commitment, a call for proposals to support palliative and end-of-life care in the province. And today, I am pleased to announce grant funding of $11.3 million for 25 projects that will improve palliative and end-of-life care in Alberta. This includes more than $1.9 million to support 4 projects that will help provide earlier access to palliative and end-of-life care, almost $4.2 million for 8 projects to expand community supports and services, more than $4.1 million for 10 projects to improve healthcare provider and caregiver education and training, and just over $1.1 million for 3 research and innovation projects. 5 of these successful projects are right here at the University of Calgary, where incredible research and education takes place each and every day. One of them will enhance physician training by using Pallium's award-winning LEAP training as a required part of the training for all medical students. By including this palliative care training for doctors, we're ensuring that the next generation of clinicians are better equipped to support their patients with life-limiting illnesses. That includes helping patients and their families through the process of making some very difficult decisions. Another project here at the U of C will focus on access to palliative care by mapping the current state of services and analyzing ways to improve access. In the community, we're funding organizations like the Alberta Hospice Palliative Care Association, who will develop and implement a volunteer training program for rural hospice societies. This is a way we can support care closest to home. At MacEwan University in Edmonton, we're funding a project to redevelop their post-diploma certificate in hospice palliative care. This will enable virtual learning to allow more healthcare providers throughout Alberta to access the training. For so many Albertans, it's important to incorporate spiritual and cultural aspects in end-of-life care. The Chinese Christian Wing Kei Nursing Home Association is receiving funding to create a culturally responsive toolkit for those working and living in continuing care homes. And a project in Fort Chipewyan will develop and establish a home-based palliative care service for the residents of this remote First Nation. From education to spirituality, and from research to grief support, all of these projects are critical to improving end-of-life care. We're very thankful for healthcare providers, researchers, educators, community organizations, and volunteers that make compassionate care a truly whole-of-society effort. In the last hours and days of their lives, Albertans deserve the highest quality of care, as close to home as possible. And I'm pleased to be able to support these important projects. I'd now like to invite Dr. Jana Holroyd-Leduc to the podium. Doctor.
Thank you. As one of the award winners or winners of one of these grants, I want to thank the Government of Alberta for investing in this important area. Specifically, my team, being led by Dr. Zara Godarzi, will be looking at the diagnosis of frailty and implementation of appropriate end-of-life care for this population. Frailty, defined as increased chance of experiencing adverse health outcomes compared to peers, is increasing as the Canadian population ages. When diagnosed early, frailty is amenable to interventions to delay progression and, importantly, to reduce symptom burden at the end of life. However, frailty is currently being underdiagnosed in long-term care. This important funding will support applied research in the area of early recognition of frailty within long-term care, as well as support early initiation of palliative care as appropriate to a resident's degree of frailty and their goals of care. We look forward to sharing the results of this important work, as do my colleagues of the other funded projects in the months to come. And thank you once again for this funding.
Thank you, Dr. Holroyd-Leduc. I'd like to thank the Health Minister, Dr. Holroyd-Leduc, and for all of you for joining us today. That brings us to the end of the formal sessions. We are thrilled that this area in frailty and palliative care has been recognized by the government as an important area to support. I'd like to now turn it over to the Minister's team to field media questions.
Thank you, Dr. Anderson. We'll now open up to the media question portion of the avail. If there's anyone in the room who'd like to ask a question. Seeing none, we'll go to operator. Do we have anyone on the phone?
Rob McNally, CTV.
Hi, thanks for taking my question, and I apologize, this is unrelated to today's announcement, but it does involve a press release sent out by the Health Ministry, specifically the booster expansion that came out on Friday. I'm just curious about the timing. The release suggests that it's just in time for school, but the understanding in the medical community is that most vaccinations take a couple of weeks to have full effect. So I'm just wondering why it's being rolled out this week, as opposed to maybe a couple of weeks prior where it would have the maximum benefit.
Well, thank you so much for the question. You know, part of the reason why just so you know, we're rolling it out like many other provinces. NACI only made the recommendation the Friday previously, not last Friday, but the Friday before then. We did the assessment ourselves over the course of the week. We had our Alberta Advisory Committee meet and agreed to follow up with the recommendation. And then once we got their recommendation, we put out the press release so that parents can start making the bookings for this week and starting to get the vaccination this week. But this is no different than other provinces across the country.
Thanks, Rob. Do you have a follow-up?
Yeah, sure. I'll take that opportunity for sure. Minister Cobbing, thank you for the answer. On a separate note, I know you're probably aware of the incident that happened up north in Grand Prairie involving Chrystia Freeland. I just wonder if you have any thoughts on sort of the anti-Ottawa rhetoric, and if you have any concerns about what you're hearing from the leadership campaign and anything that would sort of spur on that sort of activity that we saw this weekend?
Yeah, so that kind of activity is reprehensible for anyone to state, to a politician, elected official, regardless of what level of government, regardless of political stripe. Politicians, we need to represent our constituents, but people should have the ability to state their concerns, but any of that should be done in a respectful manner, without any intimidation. So I find that deplorable. That is wrong. That individual did that, and what we need to do is focus on ensuring that yes, people, if they have a concern, be able to voice that, but in a respectful manner and not in a manner that's intimidating.
Thank you, operator. Can you put through the next caller?
Catherine Grigowski, Alberta Today.
Yeah, thanks so much for taking my question, Minister. I know that this emphasis on palliative care was mentioned in the throne speech, and the Premier has weighed in on it a lot as sort of an alternative to let people know that there's an alternative to medical assistance in dying. There's different options for the end of life. With the upcoming changes to medical assistance in dying expected to take effect in March of next year, are you having any conversations with your federal counterpart on what that needs to look like in the province?
Yeah, so we did meet last week, federal, provincial, territory meeting, federal government and all the provinces. This was an item that was on the agenda in terms of the changes that are coming up and made. What's really important here is the standards of practice that are currently being worked on right now, and so that they can be rolled out. So we haven't seen that yet, but we are having ongoing conversations. And as you pointed out, is what's critically important when we look at palliative and end-of-life care is that people are aware of all of their options, and people are supported to be able to die with dignity. We are all of us will pass away, and we will all have family members pass away. So it's critically important that we have the service to support individuals, people understand their options, and we can support them in the choices that they make.
Thanks. Catherine, do you have a follow-up?
Yeah, and just on this funding, I just wanted to clarify. So this $11.3 million today, this is the funding that was announced in November, and we're now seeing what projects it's being used for. Is that correct?
Yeah, so this is 11.3 million, let's just be clear. Now, and that's 11.3 of the original 20 million that was announced in the platform. This is the final allotment, the 11.3 million, so that takes up that entire 20. Focus on the 25 projects, so that's what the funding is for, to improve access to palliative care. I would also like to say that even though this 20 million was really focused on improving training, understanding the access, doing research and development, and you can go online and look at all 25 of the projects at alberta.ca palliative grants. We are also, as part of our review of continuing care, looking at how do we continue to provide as part of that palliative and end-of-life care as well as developing the regulations associated with that. So the work is ongoing, and we continue to do ongoing assessment as how do we support Albertans in accessing palliative and end-of-life care, both through the continuing care review and also in terms of ongoing assessment of funding and what is required.
Thanks. I think we have time for one more question. Operator, can you put through the last caller?
Ashley Joanno, Post Media.
Hi, this is a question for the minister. Danielle Smith has suggested that if she became premier, she would fire the boards of AHS and the board of the CPSA. I'm just wondering what your reaction is to that and what impact you think that would have on the healthcare system.
So thanks for the question. I appreciate that there is concern out there with the functioning of our healthcare system, and we know it's under strain. It's under strain here in Alberta. It's under strain across the entire country. And one of the significant issues, and I've been touring Alberta over the course of the summer, particularly in rural areas, north and south, and what I'm hearing from people is the shortage of staff is a great concern. So I understand that there's challenges out there, and I also fully understand that people are looking for solutions. I can tell you that I'm working very closely with the board of AHS and with the CPSA on how do we meet those challenges to make sure that we have the staff available to be able to deliver the services in healthcare, not only in Calgary and Edmonton, but all around the provinces. And we'll continue to work with them to be able to deliver on the healthcare services that Albertans deserve.
Thanks. Do you have a follow-up, Ashley?
Yeah, I guess I'll just ask more directly. Do you think that firing the boards would improve the current situation in the healthcare system?
So continuing to work with the board of AHS, and the board of AHS is on this tour with me right now, and it very much understands some of the challenges. And we are working like with the board of the College of Physicians and Surgeons of Alberta. We are working with them, and particularly is how do we actually speed up the process of recognizing international medical graduates, so we can actually get more supply here. I would point out that the CPSA is a professional body, and it's important that we be balanced, like from the profession standpoint. For example, the medical doctors, half of that board is elected, and the other half is appointed by government. It is important that we work together with the doctors. It's been a long-standing practice for professional organizations to be self-regulated, and we have tools to be able to enable us to work with them on key issues like this issue of ensuring that quick recognition of international grads. So we have supply to be able to deliver the service, and I'm going to continue to work with them.
Thank you very much. That's all the time we have today for questions. If you have any follow-ups, please feel free to send it into the office. Thank you.
Thank you.